Hi guys, I would like to talk about the preview and prediction for the next episode of Dr. Romantic 3. At the end of episode 4, Professor Cha selected the most trusted medical staff of Doldum Hospital to do simulation at the trauma center for 2 months, which means the medical staff of Doldum Hospital will be reduced. In this upcoming episode, according to the preview released, Master Kim will eventually shoulder all the emergency patients of Doldum because Professor Cha chose most of his medical staff for the simulation of the trauma center. But some of the medical staff stay with him, including 2 new doctors. We can see in the preview released that Master Kim is having conversations with one of the personnel of 911, while Dr. Yoon, who is one of the medical staff left behind, is super busy saving patient lives. Master Kim knows that the lack of medical personnel has a big impact on the performance of the Doldum Hospital, but I believe that Master Kim predicted that this would happen when he started the plan related to Professor Cha and the changes he would make in the Doldum system. But all of this is under his control and his watch. Master Kim said the elephant he put in the fridge refers to a giant named Professor Cha. A small hospital called Doldum is running a large trauma center, and because they have to do big things, the existence and presence of Professor Cha with fame and skill will definitely be needed to absorb it. Because of that, Master Kim somehow managed to find an elephant. He will try to put it in the fridge and give away many things. He also said there are 2 outcomes. First, the elephant is stored in the fridge, or the elephant breaks the fridge. Thus, the trauma center is controlled by Professor Cha or Master Kim, but let's hope both of them join forces as a team. Let's see what happens in this upcoming episode. Dr. So Woo Jin's collision will be drawn. There is an intense air between Dr. So and Professor Cha. Dr. So chose not to work in the trauma center because Professor Cha chose almost everyone for the center, which means the Master Kim needs to handle every patient at Doldum Hospital. Even though Professor Cha challenged Dr. So's capabilities by telling him that his skills were not enough and he depended on the Master Kim for his confidence, Dr. So would not be affected. He will remain in Doldum Hospital. Dr. Cha thinks that Dr. So's decision was influenced by her father, but Woo Jin will explain his decision to Dr. Cha. Meanwhile, for Dr. Cha and Dr. So, there was an awkward moment because of the change in the system. Dr. Cha believes that his father is putting too much pressure on Dr. So because of his decisions about the change of management. We also understand the side of Dr. So. He knows the trauma center is one of the long-standing goals of Master Kim, and he doesn't want to turn his back on him. He wouldn't give it up easily. So, he was able not to follow the changes made by Dr. Cha's father. I hope that this will not be a reason for them to break up. I believe this will be a test that will strengthen them even more. They also have to overcome this because he is the father of Dr. Cha, and if they level up their relationship in the future, they should even be able to improve Dr. So's relationship with the relative of the woman he loves. Back to the preview. Professor Cha of the trauma center at Doldum Hospital, he took most of Master Kim's medical staff and 2 new recruits, which come out as being left in the Doldum emergency room. The patients will arrive at Doldum Hospital, and Master Kim will notice that Dr. So stays at Doldum Hospital. Dr. Soo doesn't want to turn his back on Master Kim. He thought that Professor Cha Jin Man did that on purpose so that Master Kim would work with the limited staff at Doldum Hospital. However, Master Kim told Dr. So that what you're doing isn't turning your back on Professor Cha. You're turning your back on the patient that you need to care for and save for. He believes in the people at the trauma center, but he also believes in and cares for the people at Doldum Hospital. On the other hand, Doldum Hospital emergency room with Master Kim, the most talented person who has reached the peak, and the 2 completely opposite young recruits, it looks like a crash. I hope the smooth conversation between Dr. So Woo Jin and Dr. Jang Dong Hwa will lead to a deeper understanding of his duties and responsibilities. I also wonder if it's over the gap between them or if it could continue. Looking at the episode 5 preview, The development is somewhat uncomfortable. It looks like it will continue the entitlement of Dr. Jang Donghua to his position as doctor superior to others. He provoked Nurse Park Yoon-tak in terms of positioning in the medical department on who is higher than others. So Nurse Yoon-tak could be triggered because it could also be involved in a small jealousy between Dr. Jang Donghua and Dr. Yoon's closeness, which creates a small inferiority on Nurse Yoon-tak's side. Meanwhile, there will be a patient coming to the trauma center. I think that could be the son of a provincial assemblyman who became Dr. Cha's patient. She tried all she could to save the emergency patient. On the other hand, Dr. So and Professor Cha will have a difference of opinion. It will be difficult for Dr. So to have good teamwork with Professor Cha. The trauma center will accept patients. When Dr. So wants to operate on the patient, Professor Cha tells him to give up on that patient based on his traditional principles and fundamentals. He diagnosed that the patient has no hope, so it is better for them to focus on the other patients. The guardian will hear that and get angry at Professor Cha. However, Dr. So couldn't give up the life of the patient, and the guardian keeps asking them to save her son or daughter. He would insist that he operate on the patient. But for Professor Cha, to prevent high risk and worse outcomes, he will do surgery by himself. It seemed that the operation would be fine. Because Master Kim can be seen supporting him to do good and save the patient, he can have a better solution rather than giving up, like Professor Cha said in his first remarks. He also encouraged him to do this surgery with Master Kim's support. Finally, we will get to see his surgical capabilities since he was so confident about them in front of Master Kim. However, based on the preview, the patient doesn't have life support on him, and I guess based on the scene, the woman is so angry and Director Park, if I'm not mistaken, explains to her what happened to her son. There is some theory that this is an assemblyman's wife, and this man who has no life support is his son, who is handled by Dr. Cha, which means she was not able to save the patient. Based on the given clip of the preview for episode 5, Dr. Jong is running nervously to the emergency room, witnessing Dr. Cha do her best to save the patients, and on the narration, the manager says this man is an assemblyman's son. But I observe that while Dr. Jong is witnessing Dr. Cha do her best to save the patients, it broke my heart because when Dr. Jong's lab gown fell to the ground, it could have been possible that the patient that Dr. Cha handled failed to be saved. I guess this is happening inside the trauma center, so the assemblyman's wife is questioning the capabilities of the doctor and finding loopholes of malpractice inside the new trauma center. So they are looking for someone to blame and hold responsible for her son's death. According to some theories, it could also be that Professor Cha's surgery, not Yoon Jae's, failed because he was too focused on keeping the fundamentals and principles and did not prioritize the patient's life before everything else. I hope none of this preview clip is surgery failure, but this is happening because no one can control it, even if they do all they can. What does Master Kim want to teach in this era? Let's sit back and wait. Hopefully we have one great episode next week. I hope you guys enjoyed this video. Thanks, bye.